Good day everyone, my name is Chris Daniel Samang and I am a student nurse from Tarlac State University from BSN 2B, and for today I will be performing a perineal care for both male and female uh, patient, and the purpose of this procedure is to clean the patient's perineal area as well as to inspect for any uh, redness, inflammations, lesions on the client's perineal area. Okay, so first thing that we need to do, we need to inspect the condition of our patient before starting our procedure. Okay, so good day, ma'am. My name is Chris and I will be your student nurse for today. And can I assess you po for uh, skin assessments? And I will be asking lang po for any series of questions. Is that okay? Okay, thank you po. So I will begin the inspecting po. So check ko lang po if there are any um, lesions po as well as redness po sa ating pong skin. Okay po? Okay, thank you. So check ko lang po. Okay, sabi po. Okay, thank you. And ask ko lang po sana ma'am if may in-instruct po ba sa atin si Doc na any movement limitations, like bawal po ba natin igalaw ang ating mga kamay, ating feet, or hindi po ba kayo pwede i-position like sa sitting position, mga ganun. So wala naman po, that's so a good sign. And for our next step, for our planning phase, we do need to have a warm water. For example, this has warm water, a uh, a waterproof bed pad, as well as towels for the rinsing, washing, as well as the drying of the patient's perineal area. And for our next step, for our implementation phase, we need to check the physician's order or the nursing care plan uh, before conducting our implementation for the areas that needs to be treated, as well as the duration of our therapy. Okay, so for our planning phase, for our performance phase, first is we need to introduce ourselves to our client and verify the client's identity. Okay, so good day po ma'am. As I have said earlier, my name is Chris Daniel Sumamang and I am a student nurse from Tarlac State University, and I will be your student nurse po for today. Okay po. And may I ask your name po ma'am? Okay, Miss Love. Oh, and may I ask for your birthday po? Okay. And ask ko lang po sana if pwede po makita yung inyo pong hand for its wristband. Okay, thank you po. Thank you po ma'am. So for today po, next is I will be explaining the procedure to my patient, and I will be explaining what I am going to do and why is it necessary and how the client can cooperate. Okay, so today po ma'am, I will be giving you a perineal care po. So, of course, you can choose po if you want to do it yourself or you need assistance from us nurses, student nurses. Okay, so what do you think po ma'am? Will you can you do it yourself or do you need our help po? Okay, so you need our help for this instance. So I will be getting po your consent because I will be touching po some various parts of your perineal area. Specifically po, I will be touching it with my fingers po. So is that okay with you po? Okay, so I will be doing this po. It is very necessary to make sure that your perineal area is clean always, and this will give me an opportunity to assess for any skin problems like lesions, like inflammations, and so on and so forth. Is that okay with you? Okay, so will you cooperate with me po? Okay, thank you po. And now that we got the patient's consent, now we will be performing hand hygiene and we will be putting on some PPE as indicated. Okay? We will be rubbing our hands till the alcohol or our hands is dry. Okay. After that, we need, after putting our PPEs and doing the hand washing or the other infection control procedures, we will now give our clients some privacy for closing the curtains around the bed and closing the doors to the room if possible. Also, we can uh, close the windows for privacy. And after that, we do need to have a adequate lighting. So for this instance, I have already the adequate lighting that I need coming from above for our lights. And for our next step, I will be asking my client that I will now be exposing his or her perineal area. Okay? So, ma'am, expose na po natin ang ating pong perineal area. Okay lang po? Okay, but before we do that po, I will be putting po yung atin pong waterproof pad sa atin pong likod to avoid the bed from getting wet po. Okay lang po? Okay, so what I'll be doing po is I will be repositioning po sa side po na to. So I can put po yung atin pong waterproof pad sa inyo pong back. And again po, I will be repositioning nyo naman po sa akin pong side para po ma-roll ko po yung atin pong waterproof pad all the way po sa atin pong bed. Okay po? Okay, thank you po. So, ready po. You can hold the rails po on our other side of the bed to avoid po from falling from the other side. Okay po? Thank you. So, 1, 2, 3. Okay. 1, 2, 3, 4. Okay. So for example, and we will be putting the waterproof pad that we rolled onto the back of our client. Okay. Now, I will be positioning you on my side po. Okay, so you can hold the rails on my side po so you will not go all the way through and fall. Okay, 1, 2, 3, go. Okay, so now I can roll the waterproof pad all the way to the edge of the bed. Okay. Thank you. You can go back now, ma'am. Okay. Yes. Okay. And for our next step, I will be exposing na po what is needed to be exposed po for the perineal care. Okay lang po? So, I will be exposing lang naman po what is needed to be exposed. Okay? Thank you po. So, I am exposing now your perineal area. Okay. 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 Now we will be starting on the perineal area for the females. And to do that, we will need to have a, just like I told earlier, is a warm water and some towels. Okay, so to start, we will need the first towel. It's either you can choose to make your towel to a bath mitt, or you could use the square technique. So for this first one, I will be using a bath mitt out of this towel. Okay. So what we're going to do, we will be using the corners of our bath mitt for the uh, our perineal for the patient's perineal area. So first is this corner, next is this corner, and the middle one. So we will be doing it from the top to bottom. Okay, so are you ready, ma'am? Okay, so example, I have already put my bath mitt on a um, warm water, and I have put a for example, soap if the client wishes to use soap. Okay, so I will be rubbing it, and I will start from the top of the perineal area of my client and down to the bottom. So I will be I will be using my non-dominant hand to separate the uh, labia so I can clean the perineal area for the female uh, more efficiently. Okay, so ma'am, I will be touching po yung inyong pong perineal area. Is that okay with you? Okay. Spread ko lang po ng konti and using the first corner of our bath mitt, using it from top to bottom. Okay, from top, the other one, top to bottom, and the middle one from top to bottom. Okay, and we'll be using another towel. Now we'll be doing the square technique, which is we'll just fold it like this. Okay. Now we will be rinsing our client's perineal area. First is the clean surface of our towel, and we will be rinsing it. First is from again from top to bottom, top to bottom. Now we fold the unclean surface of the towel. Now the surface that we're facing now is clean again, and we'll be doing it from top to bottom again. Repeated it. Yes. Okay, from top to bottom. Fold it again. From top to bottom. Okay. Be disposing again the towel that we use. And for our last towel, this is used for the drying of the perineal area of our client. Okay. From top to bottom, the sides. Okay. So for example, that the perineal area of our client is now dry. This is for the females. And for example, our patient is male. So let's move this for a while. This vagina. Now we will be using a penis model. So for example, our patient is male. Again, for the first towel, we will be putting it on the water or warm water, and it's either if the client wants to use soap to be wiped on his or her perineal area, we could do that. So sir, do you want to add soap or use soap in your perineal area? Okay, so for example, I have put soap on the bath mitt, and we will be rubbing it. Okay, so what we're going to do here, if our patient is male, we will be just wiping the penis in a circular motion. First is the top. It's on a circular motion. Okay, circular motion. Okay, and for the last corner or our middle is for the scrotum. Okay, and we will be disposing this towel. And again, for our next towel we will be using the square technique. We will be putting it again to a warm water. For this is now for the rinsing of the soap that we put on the client's perineal area. So again, for the first fold, we will be again uh, doing the circular motion, okay, to rinse the penis. Okay, next is for the next fold. Okay, rinse again. Okay, next fold, circular motion again. And for our last fold, we will be patting or rinsing the patient's scrotum. Okay. And lastly, for our last towel is for the drying of the client's perineal area. Okay, so again, we will be doing the circular motion for the male reproductive system. Okay, so circular motion. Okay, circular motion. And last for the scrotum. Okay. So now we will be moving away the female reproductive organ as well as the male reproductive organ, because now we will be focusing on the area of the patient, which is the buttocks. We will need to ask, this is for both male and female. We will be asking again our client to, we will be repositioning our client to the side away from us, so we could we could wash, rinse, as well as dry the patient's perineal area on the back side, which is the buttocks. Okay, so ma'am, move ko lang po ulit kayo sa side po dito, away from me, so I can wash po yung inyo pong perineal area sa back, or specifically po yung inyo pong buttocks. Okay, thank you po. Ready? In 3, 2, 1. Okay. Okay. Again, we will be using a bath mitt for the back area. So we will be putting again it on a warm water, our towel, as well as we will be putting a soap. Okay, so we're gonna rub it, and we will be doing it from the front to back, or from this side, this portion outwards. So for the in or two out, in, out for 3. First is the middle, then the sides of the gluteal area. Now that we have done that, it's time for the rinsing. We will be placing again our towel on the warm water, and we will be rinsing it again from the inside to outside. First one is the middle, and inside from the other side, and this side from the other side. Okay, now that we're done rinsing, now we will be patting dry the patient's buttocks. Okay, so again, from the inside to outside, inside from the other side, and inside again from the other side. Okay, now that we are done, again, we'll be instructing our client that we will be putting him or her back to the original position. Okay, so ma'am, babalik na po tayo sa other position. Dati natin position. Okay, so ready in 3, 2, 1. Okay. And I will be moving my patient to my side so I can again remove the I can remove the waterproof pad under him or her. Okay, so ma'am, I will be putting you on my side. Ready in 3, 2, 1. Okay, I will be rolling it again. Okay, and I will be putting you again on the other side. Ready in 3, 2, 1. Okay. Now that the bath or the waterproof pad is out of the way, for our next step, I will be uh, repositioning my client to a position of comfort. Okay. So, ma'am, I'll be putting you po sa position of comfort. Okay. Ready? 3, 2, 1. So, okay na po ba tayo sa position na yan? Okay. And after that, we will be helping our client in putting on his or her garment, undergarment that we took off earlier before starting the performance. Okay. So, for example, that we have put on the undergarments of our patient. Now it's time to document our findings to the client's record. Okay, so for example, this is the client's record. We will be documenting the findings to the client's record or forms. And we will be documenting our findings to the client's forms or checklist that supplemented the narrative notes if applicable. And after that, we will need to okay, for our next step, we will need to remove our gloves that we have worn using the glove-to-glove technique and skin-to-skin technique. Okay. Okay. After that, we will be performing again hand hygiene. Okay. And after that, we will need to document our findings in the client's record using forms or checklists that is supplemented by the narrative notes if applicable. Okay. For example, this is the patient's chart. Okay. We will be documenting that we did a perineal care to the patient and the duration as well as our signature. Okay, and after that, for our evaluation phase, we need to perform a baseline data or baseline findings that may deviate the expected or normal for the client. And we will be comparing this, or we will relate this finding to the previous data if available. And after that, we will be reporting abnormal findings that we saw during the procedure to the primary healthcare provider. And that would be all for the performance of the perineal care of the male and female patient. And again, my name is Christine Sumawang, and I am a student nurse from Tarlac State University from BSN 2B. Thank you.